Having talked about the different thyroidal conditions ranging from the hyperthyroidism, which is also known as thyrotoxicosis or Graves' disease, and then we have another condition which is characterized by hypothyroidism. So all of these thyroid hormones have their own neuropsychiatric manifestations, although they have the metabolic manifestations as well. The growth and the development of the person is also affected in these cases, but the mood and the sexual functioning is also affected in these cases of hyper or hypothyroidism. So then we have another important gland. It's basically a paired gland, which is known as the adrenal gland, and it has its own functioning. It's basically the secretion of cortisol that is manifested due to this gland. And due to the oversecretion of the cortisol, we have a condition which is basically characterized by the hypercortisolism, and then we have the undersecretion or the underworking of this adrenal gland. So we have one condition which is known as the Cushing syndrome, which is due to the excessive secretion of the adrenal glands, and then we have the adrenal insufficiency on the other hand, which is also known as the Addison's disease. They have their own clinical manifestations, but we are just concerned with the neuropsychiatric manifestations over here when we are dealing with the Cushing's patient, and on the other hand, when we have a patient of the Addison's disease, one should know what are the neuropsychiatric manifestations observed in these people. So over here in this section, we're just focusing on Cushing syndrome. That is basically the condition arises due to the excessive secretion of the adrenal gland over here. Usually we have a clinical picture of an obese person. The buffalo hump is the characteristic feature over here when we are discussing it. The neuropsychiatric manifestations, when we are considering them, they are basically consisting of the psychosis. And on the other hand, we have mania in these patients, and along with mania, we have the other sort of patients who are suffering from the hypomania. So usually you'll be having a picture of this obese person suffering from hirsutism and also the buffalo hump. These are the apparent features, the moon-like face. These are the typical clinical pictures that are seen in a patient of the Cushing's syndrome. But the neuropsychiatric complications that the person will also be suffering from will be psychosis, mania, or he or she can also suffer from hypomania in such a state. So the psychosis is usually known as the myxedema madness in these individuals. Buffalo hump is quite commonly observed in these individuals. The typical presentations of the psychotic symptoms in the myxedema madness is the delusions. The delusions can be of the paranoia type, and the person can also suffer from the delusions of grandiosity in such a case, and as well as the person can be suffering from the auditory and the visual hallucinations on the other hand. In very rare cases, the person can be suffering from the tactile hallucinations in this case. Then the preservations, the thought disorganization is again very important over here, and we have to focus on this as well over here. 5 to 15% of patients with hypothyroidism is going to suffer from this kind of a myxedema madness kind of a picture over here that we're discussing. Now, when we're ranging from the Cushing syndrome, the hypercholesterolemia, which is also known as Cushing syndrome, the depression is the major neuropsychiatric manifestation that is seen in these people, which is on the average in 57% of the patients who are suffering from hypercholesterolemia or the Cushing's syndrome. The range of 50 to 80% across the studies, the higher cholesterol levels in these patients with increased cortisol without depression. So there are a lot of researches that have been conducted on this hormone, which is known as cortisol, and it's almost a 50% rate that is seen people who are suffering from depression. And when cortisol levels were calculated in these patients, almost 50% or almost 57% of the patients were suffering from a hypercholesterolemia condition, which is basically characterized by the Cushing syndrome in these people. We have the mania or the hypomania, which is also observed in these patients. Almost 30% of the patients, they present with hypomanic or the manic symptoms. So we have a patient of basically hypercholesterolism who has basically presented with mania or basically any bipolar affective disorder over here. Then we can have the subclinical mood fluctuations that are more commonly seen in these individuals. Even though they're not going to be presenting in the outpatient departments or in the emergency departments with these mood disorders, because they're going to be of the subclinical sort in these individuals. The hypomania or mania is basically the earliest sign of illness of the onset in these individuals. So this is basically the highlight, and sometimes if a physician who is smart enough, who can basically detect this mania and hypomania in this individual, and he's also going to basically correlate these features of mania and hypomania with the other clinical features in this individual who is having that moon face, obesity, buffalo hump, hirsutism. He can basically correlate with this clinical picture and perform the laboratory investigations that are required in this particular individual about whom we are talking about. The anxiety in these individuals, the rate of the generalized anxiety disorders is almost 79% in these individuals. The rate of the panic disorders is as high as 53% in these individuals. The cognitive dysfunctioning in almost 2/3 of the patients with Cushing syndrome is quite common in these individuals. And then we have the non-verbal visual ideations abilities that are also present in these individuals, as well as the visual memory, spatial construction abilities are also affected in these individuals of Cushing's syndrome over here. So usually the panic, the anxiety, these are the key features that have to be noted down in a patient who is suffering from Cushing's disease or Cushing's syndrome. The management or the guidelines that we have to follow over here are the successful control of the hypercortisolism. So it's not going to be the mood disorders, it is not going to be the affective disorders that are seen in these individuals that we're going to try to treat. It is going to be the underlying pathology, that is basically the raised cortisol levels in these individuals. That should be the target of the management or the treatment guideline that we have developed or we have designed for that particular individual. They can result in the progressive improvement of the psychiatric symptoms. There is going to be an improvement of the cognitive functions. So it's basically the main aims of the management or the treatment guidelines that are discussed over here. And it's not always the case. The prevalence of the diagnosed psychopathology is almost 54% at 3 months of the treatment guidelines. So in this section, basically, we summarize this condition, which is known as Cushing's syndrome, which is characterized by the excessive cortisol that is present in the blood serum levels. So, and what are the neuropsychiatric complications that are related to this Cushing's disease? So that is the end of this section. Thank you for watching sqadia.com.